Hi, Mrs. Smith. It's really nice to see you again. I see you're back to follow up on the stroke you had. How are things going for you at the rehab facility?
Kind of slow.
Kind of slow?
Yeah.
What kinds of things have you been doing in your rehab?
Oh, they have me doing all kinds of things and different machines and stuff. Yeah, it hurts.
It hurts? Oh, I'm sorry to hear that. Where are you having pain?
Well, just about every joint, especially my knees.
Yeah.
They're really,
Yeah.
they have me doing some leg things that is it really necessary?
Well, I understand that pain is hard to work through, but a lot of times when you're having rehab after a stroke, that pain is telling you that your muscles and joints are starting to work again. So you can kind of think of it as a positive way to, know that your body's getting back to normal. So,
Okay.
But what are your goals for the long term?
I want to go home.
Oh, of course, of course. And what are the things that you'd like to be able to do once you get home?
Everything. I want to play with my dog. I miss my dog. I want to cook for myself. I'm a very independent person, and I want to do things for myself.
Yeah, yeah. And so that's a very important goal, to be able to get back home, to be able to get back to your independence. Have you thought about what it might take to get there?
I guess the rehab.
Yeah, you're absolutely right. And it's also going to be very important that once you're home, you're able to continue on a regular activity program. Have you thought about what that might look like?
Not really.
Not really? Okay.
Yeah.
Well, have you ever heard of something called Tai Chi? Is that a familiar term to you?
Yeah.
You've heard of it?
Oh, I have.
Okay.
I have a friend who does it, and she just raves about it. She loves it.
Well, Tai Chi is one of the best ways to get your balance back after you've had something like a stroke, and it's also really good for preventing falls. And if you want to be home and you want to be doing the things you want to do and going for walks with your dog, it's very important to make sure that you don't fall, because that could cause more problems down the road.
Absolutely. I do not want to fall, for sure.
So what do you think about Tai Chi? Is that something you think you might be able to try sometime?
Well, I hadn't really thought about it, but yeah, I guess. Like I said, my friend talks about it, and it's very pretty. I've seen pictures,
Yeah. Well, it's not that easy to get started. You do certainly have to have some motivation to want to do it. And when you first start, oftentimes you do feel a little wobbly or a little insecure.
Well, I don't see how I could do it. I'm still in a walker,
Yeah, I understand. So there are lots of places around that have it. Your local senior center would have it. And what I recommend is that you start by doing it in a chair, just sitting in the chair.
I could?
You could. You can talk to the instructor, and that way you won't fall. You'll feel confident, and you'll start to learn some of the moves. And then gradually over time, as you get a little bit better at doing the moves in a chair, you can start to stand up, use the chair to lean on, and then eventually you'll be able to get to the point where you can do it on your own.
And you really recommend this?
It cuts your risk of falls in half. It also helps to reduce pain, although that's not a short-term benefit. You do have to stick with it for at least 3 to 6 months to start have it help reduce your pain. But it does have a number of things that I think would get you to your goals of being home and able to play with your dog and doing your own cooking and things like that.
You do Tai Chi?
I do Tai Chi. I do it 3 days a week, and it's really helped my balance as well.
Oh, okay. Well, yeah. Listen, anything that's going to get me home. And if you do it and you recommend it, I'll try it.
All right. Well, I'm delighted. It's a pleasure to see you again. I hope your rehab continues to go well, and we can talk some more about this at our next visit.
Okay.
All right. Thank you for coming in.
You're welcome. Thank you.